Pop quiz. Someone left this in the comment section of another video for me, so I'm going to answer it for you. The nurse is observing a staff member caring for a client who has chickenpox. Which of the following actions by the staff member would require the nurse to intervene? 1, placing the client in a private room with monitored negative air pressure. 2, placing a box of disposable face shields outside the client's room. 3, placing an alcohol-based hand rub in the client's room for hand hygiene. Or 4, placing a surgical mask on the client during transportation out of the client's room. What do you think? And guys, the correct answer is 2, because when a question asks you when you're going to intervene, well, guess what? You're only going to intervene if something's wrong. This patient has chickenpox. What's that? Varicella. Anyone with chickenpox, they're going to be on airborne precautions. They're going to be on contact precautions. So let's look at our wrong choices and we'll go back to the right one. Well, I'm calling them the wrong choices, but they're the wrong choices because that's what you're actually supposed to be doing. 1, placing the client in a private room with negative air pressure. Absolutely. Why? Again, airborne precautions. 2, that's not what we're going with. 3, placing alcohol-based hand rub in the client's room for hand hygiene. Absolutely. 4, placing a surgical mask on the client for transportation. We don't want to transport that patient anywhere outside their room unless we absolutely have to. But if we absolutely have to, they're going to have to put on a surgical mask, right? Why would we intervene? In other words, which one is wrong? It's number 2, placing a box of disposable face shield outside the client's room. Remember, this patient's going to be on airborne precautions. So anyone going into that room, guess what? They're going to have to put on an N95, not a disposable face shield. It's going to be an N95. So the fact that you're seeing disposable face shield outside the room, which means that's what people are going to be wearing when they go into that patient's room, that's the reason why the nurse is going to have to intervene, because it's wrong. Everything else, choices 1, 3, and 4, all of those are correct. That's why you wouldn't intervene, and that's why it's not the correct answer. Does that make sense?